So there are many things that you cannot choose. Okay, for example, the DNA that you're made of, you cannot choose it. The family that you're born into, you cannot choose. And then the surrounding that you grew up in, you cannot choose. I mean, I grew up in Hong Kong. I was born in Hong Kong. I grew up in neighborhoods that is all run down, in poor neighborhoods. These are the things that you cannot choose. But your choice is, how hard do you work, what is your goal, and what path you're going to take to achieve your goal. So, over the years, as you grow, when you grow up in school, your physiology change, and then your personality change, and then as you grow up, you rise up in this pyramid and become a person with a personality and self-actualization. So I went to Catholic schools all my life, well, most of my life, in primary school and secondary school. And this is the name of the Jesuits high school that I went to. And in a way, it's very important that your peer have a lot of influence on what your thinking is, and also on your aspirations. I was fortunate to go to this Jesuit high school, and as you know, that the Jesuits place a very important stress on the pursuit of knowledge and learning. And in our class, a lot of my peers pursue higher education, either in Hong Kong or abroad. So while during the high school years, I came across this series of books, especially this series of books that was written by John Powell, S.J. S.J. means Society of Jesus. He is a Jesuit priest. So he wrote this book that was originally published in 1975 by Fontana. The name of the book is called Why Am I Afraid to Love? Or this in the series, okay? The actual book that I love to read is the Why Am I Afraid to Tell You Who I Am? So the importance of this book is that it helped me to, it encouraged me to communicate and interact with people, and leading to personal maturity and self-awareness. The first thing, when you grow up, the first thing that must happen is to know yourself. Okay, you need to know yourself. You need to know what you like. Okay, what you're made of. What are your bad habits? What are your good habits? What are your good traits and bad traits? Okay, you need to learn self-discipline. You need to know what are your bad traits and how to improve it day by day. Okay, so if you are not aware of your bad traits, you will never improve, and you cannot be unless you see a goal, you don't know which direction to go. So, back in the old days, in Hong Kong, and the high school, in the course of the high school education, and we have to choose what type of subjects that we're going to study. We can choose art subjects, studying literature, English literature, Chinese literature, history, etc. Or we can study sciences that either focus on biological sciences or focus on mathematics. Okay, and usually the people or the students that chose to study mathematics would become engineers, and the people that chose biology would become either physicians or veterinarians or basic scientists in most of the biological science fields. including botany, agriculture, etc. So peer influence is very important. Most of my classmates ended up as engineers and doctors, lawyers, business administration people. And when I graduate, I faced the choices. Whether I would stay in Hong Kong and compete for the limited number of spaces, place in the university in Hong Kong, or go abroad and go to the United States and study. The choices that I had, or the opportunities that I had, was to go to the University of Houston and study chemical engineering, or go to Vincennes University and have the undecided major, and then from Vincennes University transfer to a different university after a couple of years. So I love this movie. I think this movie is very inspiring. This movie is called The Pursuit of Happiness, and basically it shows that this guy was very poor to start with, and through hard work, and he pursued the American dream. The American dream basically is summarized in 3 words: life, liberty, and the pursuit of happiness. And through hard work, he was able to achieve what he wants. And I think this movie is very inspiring, and if you have time, I would encourage you to watch it. So my ultimate goal was to become a physician. So in order to become a physician, I need to get to medical school. And my choices are to study different majors that we can choose in college before getting into medical school. The system is a little different. In America, you need to get a bachelor's degree first, okay, and then go from the bachelor's, after you get your bachelor's degree to enter medical school. So I guess it's different both in Hong Kong and in Taiwan, or in many different other countries except Canada and the United States. That the medical schools will require a bachelor's degrees before entrance. So in America, so my choices are to either study pharmacy or pre-medicine or chemical engineering, and get those degrees first before entering medical school. So my choice is that I started out with chemical engineering, but after a year of taking some engineering courses, I find that that didn't appeal to me very much. So I changed major and changed from chemical engineering to pharmacy. Why did I pick pharmacy? Yeah, I think that drugs are tools that the physicians use to treat patients. So if I become an expert in drugs, okay, that would help me later in medical school, and in fact it did. With my background in pharmacy, after I entered medical school, I did not have to take biochemistry, and I did not have to take pharmacology. I just take the exam and pass it. So during my college years, of course, college years, the romance comes along, and I traveled, and I picked up a new interest. Those are the days when the personal computer is just being born, and my very first computer was a compact, portable compact PC. And you can see that this type of compact PC only have a floppy drive and a monochrome CRT terminal, and it weighs a ton to carry around. So, but that started my interest. So since then, that was pretty much the only computer that I bought. Since then, except for the laptop computers, all my desktops I put together myself. So I learned to both in terms of my curiosity, I still learn about the parts of the computer and how to put it together, as well as learning the logic, the software, and the programming. That sort of helped me both as a hobby to take my mind away from, I guess, to rest. And as well as it would help me in research also. So in that time, in order to pay for my college education, I started working for a professor. I started out washing dishes in the laboratory. Okay, so after a couple months of washing dishes in the laboratory, the professor asked me, "Would you like to try some experiments?" So that's how I got started in science. He started training me in addition to washing dishes for him. I started to help him to do experiments. I learned to do micro dissections, to cut the eyeballs out of a small mollusk together with the optic nerve, and do electrophysiological measurements of compound action potentials from the optic nerve, and to study the biochemistry of circadian rhythms. So that's how I got started in research. So that research is basically as a part-time job as a research assistant in this laboratory during the college year while I am going to pharmacy school. So then I graduate from pharmacy school, then I get married. Now what do I do? Okay, what do I want to with my life? Should I? Because now I have a wife to support, and how do I still want to pursue my goal of becoming a physician to study medicine? And in fact, how can I get there with a wife to support? So the thing is that the way that I did was to pursue to work as a pharmacist full time, okay, then have support my wife to go to nursing school, and she got her bachelor's of science degree in nursing. And during that time, while I'm working full time as a pharmacist, I continue with my professor and as a graduate student. And I got the master's degree and the PhD degree with him as my PhD advisor. So then after 4 years, I graduate with the PhD degree, and my wife graduated with the nursing degree. And then I applied to medical school and got into St. Louis University School of Medicine. So, as you might know, that medical school in America is very expensive in order to pay for the medical education. My wife worked as a nurse in the intensive care unit to support my tuition, and I also moonlight part-time on night shift and weekends in the pharmacy to help pay for the tuition. So, medical school is 4 years in America. So after medical school, and it comes to another major decision point. So what do I choose? What branch of medicine do I want to get into? So these are the fields that are of potential interest to me, and since I know drugs very well, so the field of medicine that use drugs a lot is internal medicine. Okay, so that's what I picked. So I matched for residency at Baylor College of Medicine in Houston and came to the Texas Medical Center. And the Texas Medical Center is a very big medical center, probably the largest medical center in the world. And among there are several hospitals. The City Hospital, associated with Harris County, is the Bentop General Hospital. That's where we did most of our training, and also the Michael DeBakey Veterans Administration Hospital, which is the biggest VA Veteran Administration Hospital in the United States. And in fact, that building is the second largest federal building in America. The largest federal building in America is the Pentagon, and this VA hospital is the second largest federal building. So the time flies. Okay, 1 year of internship and 2 years of internal medicine residency, and then now it's time for fellowship. Since I was trained in the signaling and receptor signaling in the course of my PhD training, so I picked endocrinology, the signaling of hormones and the study of hormones as my subspecialization. So there's another 3 years for fellowship training. So after fellowship training, then I face another decision point. Okay, what do I do? What kind of job would I like? Okay, would I go for a private practice or go for a academic medicine position? And if I pick the academic medicine positions, would I pick to stay at Baylor College of Medicine as a junior faculty in endocrinology, or as a general internal medicine junior faculty at MD Anderson Cancer Center? So the choice, this is a very difficult choice to make. Baylor College of Medicine, of course, is quite a famous medical school, but MD Anderson at that point was number 2. Well, fighting with Sloan Kettering between number 1 and number 2 at that point. So it is this premium medical cancer center, and what solidifies the choice is that MD Anderson pays better, and also that my mentor at MD Anderson, Dr. Gable, he is willing to provide me with laboratory space and some startup seed money for me to start my independent research career. Okay, that really is seals the deal. So I decided to stay at MD Anderson. So I have an MD degree and a PhD degree, okay, and ultimately I would like to do both. Okay? The goal, after so many years of training, you don't want to waste any of that training. So it is very important to combine the two together. Because as a pure scientist at the bench side, you may not be aware of what information is important to the clinician, what information would be able to help millions of patients. Whereas if you know both sides of the world, then you can be the bridge between the clinical science and the basic science. So I see patients in the emergency center of MD Anderson, and based on the clinical years of clinical experience, as I accumulate the experience, so now I have been there for 16 years. So this is a very unique emergency center that all the patients, or practically all the patients, over 95% of the patients, have cancer, and they all have different kinds of cancer. Okay, all kinds of cancer patients that are coming to our MD Anderson Cancer Center would at some point with emergent or urgent problems that need quick intervention, and they would show up in our emergency room. Ranging from something that simple, like they ran out of medicine and they're in acute pain, or they coming in with cardiac arrest, that we revive. Okay. So with the accumulation of the clinical experience, and also started editing books about our experience, and I have edited 2 books so far, and also offer some chapters about oncological emergencies in the major cancer textbooks. So it is a long road, okay, starting from bachelor's degree, okay, entering college at the age of 18, okay. So for pharmacy degree, that is a 5-year program. It's a 5-year professional program. So there's 5 years. Master's, 2 years. PhD, 2 more years. So 4 years to get the PhD degree. Another 4 years to get the MD degree. 3 years of, 1 year of internship, 2 years of residency, and 3 years of fellowship. So you can count how many years. So my wife calls me a professional student. So, but the thing is that you need to have your goal. Okay, you look far and see. Imagine yourself. Try to imagine yourself 20 years or 30 years from now. What do you want yourself to be? Okay, so you have your goal. You aim high. Okay, but it's a long road. Okay, but you will get there. You'll climb up the steps one step at a time. So how can I make it if I'm not a genius? I admit I'm not a genius. Okay, there's a lot of my peers, my students, my colleagues are much smarter than me. I'm not as smart. I'm half as smart. Start with me. So, but how can I make it if I'm not a genius? Okay, lucky. Okay, somehow the luck doesn't seem to make friend with me. Anyway. So I have to rely on hard work, okay? And how hardworking is hardworking, okay? So the question is, you ask yourself, how much sleep do I need, okay? So I am a person that need quite a bit of sleep. I need at least 7 hours of sleep per night in order to function well. So how much time do you need for personal care? Okay, so shower, brush my teeth, okay, go into the bathroom. Okay, so how many hours does that take out of your day? Okay, so how much time do I need for relaxation or interpersonal relationship? Okay, I got to see my wife sometimes, right? And as well as my children. So you count those hours, okay, and then subtract them. So I'm sure that you would still have about 80 hours per week left available. So in America, the standard work week is about 40 hours per week. Okay, and if you work 40 hours per week, it's considered full time. Okay, so that's how I make it through the graduate school. Okay, I work 40 hours full time as a pharmacist. Okay, it pays pretty well, so enough for me to pay the tuition for the graduate school as well as support my wife through college. So 40 hours per week as a pharmacist, I still have 40 hours to work on my PhD degree. So that's how I made it. Others have done it. Okay, you'll make it. Okay, can you devote 80 hours per week? Other ways that would help you to make it is efficiency. Okay. I think you've seen Dr. Lee's slide earlier. That is very similar, isn't it? So I mean, we share some of our slides. So efficiency is very important. Do it right. My motto is do it right and do it once. Okay. So for many of the data analysis or preparing pictures or figures or graphs. Okay, always do it with the goal of publishing it. So if I make it the first graph already publication quality and publication ready, then it's done. It's done. Okay, so I don't have to mess with it anymore. So goal-oriented. A lot of times, we have bad habits of procrastination. I procrastinate a lot of times. Oh, okay, that's always tomorrow. I can do it tomorrow. So, setting target dates, deadlines. Okay, you have to force yourself. I've got to get it done before that such and such date. Okay, so if you do not set target dates, things would keep on being pushed backward, and there's always another tomorrow. Multitasking. Okay, so back in the old days, okay, our computer only had one processor, and you can see how slow they are. Okay. Now these days, a Core i7 processor. How many cores do they have? They have 4 cores. They have 4 cores, but they also have each core can function as